There are now 5 cases of measles in Rockwall County. The state says all 5 are in the same household.
So this comes a week after a top federal health official urged people to make sure they were vaccinated. Fox 4's Amelia Jones has more on the cases from Rockwall. Amelia.
Heather, Steve, Rockwall County Health Authority told me the county is not concerned with a possible spread because the cases were caught early and contained to the same household. However, with the recent rise in cases across the country, healthcare officials are urging people who are unvaccinated to reconsider their risk. A Rockwall County family is quarantined at home after 5 children contracted measles. Rockwall County Health Authority says the family traveled overseas and a younger child tested positive for a strain of measles reported abroad, not the same strain doctors are seeing in the U.S. Still, the family pulled the other 4 children out of school before they started showing any symptoms. None of the children were vaccinated.
So that's good news for the community. There's no exposure within the schools. There's no exposure within the communities. The only exposure that we're aware of, there were 2 medical facilities that the mother took their child to. We've made them aware, and as far as we know, there's been no connections to any further cases.
Well, Dr. Dirk Parrott with the Rockwall County Health Authority believes concerns for a possible spread at the local level is low. There is concern with a rise in cases across the country. So far, the U.S. has reported 700 measles cases.
If you're unvaccinated, you're traveling, especially to an area that might have cases, you should be concerned.
This has sparked renewed effort to encourage people to get the vaccine, even at the federal level.
5-10 years ago, if you didn't vaccinate your children, the risk of getting measles was close to 0. That number is not close to 0 anymore. So I think families that have foregone vaccination might want to reconsider that risk.
Last year, Texas saw its largest measles outbreak in decades. Symptoms can start out similar to an upper respiratory illness or common cold before the telltale sign of a rash appears.
When you're in that pre-phase, you are contagious, and most people think they have the common cold or an upper respiratory illness, and so that's why it's so infectious.
Some do end up in the hospital if there are complications, and the disease can be fatal. 2 children died from the disease in Texas last year. People who are most at risk are those who are not vaccinated.
I don't think measles is going away. This is going to be with us unless the vaccination rate changes.
So far, no other counties in North Texas have reported cases of measles. If you believe that you have been exposed or you're showing symptoms, it's advised that you call ahead to your doctor and wear a mask to limit any possible exposure.